Welcome, everyone. It's another episode of Hashtag On Point with Dr. Pam. We have Margaret Wright in the house, and let me tell you, what a special guest. She has earned her bachelor's degree in biology with a minor in biochemistry. She has her bachelor's of nursing. She spent 20 years in critical care, hospital-based nursing. She earned her master's degree in natural health. And she had to stop along the way with breast cancer. So if you're confused about what to eat, what not to eat, what to drink, and not to drink, stay tuned as we introduce Margaret Wright so that you move from confusion to clarity. And with that, Margaret, welcome.
Hey, thanks, Pam, and hi to everybody else. Let me just clarify that a little bit about the diagnosis of breast cancer and stuff, because yes, I was still active nursing at the time, and I was 40 years old, feeling good. Everything's going well. And, 40 is when you tell you to do your first mammogram and all the rest of it. Well, it showed up that it was definitely breast cancer. We just don't know how bad. Take yourself to see a surgeon who wanted to, do the usual cut and slice and everything. And I said, no, just a biopsy. And while I'm waiting the week for the biopsy results to go back, I hit the hospital library, which was a shock because what I'm reading in the medical journals contradicted just about everything I was being told, about treating breast cancer. So when I got the results, I talked to the surgeon who I knew from the hospital and had chosen very carefully, and said, look, I don't want to do that. We have the biopsy and I just want you to monitor me. Then we got the whole but routine. And I went off and did my own thing, which is where, now this is back in the mid-90s, and some of the terminology has been updated since, but back then everybody was talking antioxidants, you got to do, push this kind of stuff. And in my reading, I'm looking at things like at what they call endogenous antioxidants, glutathione, superoxide dismutase. And it's like, okay, this is where the problem is. So I made my changes. Took them 19 months before they couldn't find anything. And so I just kept behaving myself. I figured I'd eaten my way into it and I could darn well eat my way out of it, which is what I've done. And yes, that was at age 40, and my last birthday, I was 70. It's a number. It's a pretty good number, but I don't let that define me. And it was kind of neat. Down here in Florida, you get special discounts if you prove you're over 60.
Discounts are wonderful.
And I got carded,
That's
this
right.
is cool. But anyway, so that was really my transition. That said, I had to get out of nursing because the discord was just too much for me to handle in giving out the medications to patients in the hospital, and knowing in my head that all came with complications, side effects, need for more medication, and never really treated the upstream issue. And that's where, back in the 90s, trying to talk about health versus, or a health model versus a sickness model, I may as well have been talking to the wall. And I was in the transition working for a physician in his office, and he was very alternative minded. And he had me start giving monthly nutrition lectures in his office. And the first 3 months, all I talked about was antioxidants. I had a whole thing on glutathione and all it did for the body, and how to, keep your liver health, and what does liver have to do with glutathione? Well, if you don't make it, you can't do any of the other stuff. And so I was on that bandwagon and transitioned back into more health related fields. And yeah, I've grown a lot, learned a lot about food, And let's face it, the food and any supplements or whatever you might want to take, it's just chemistry and biochemistry.
Well, let me insert myself here for a second. You know, your cancer diagnosis and your decision not to follow traditional medicine, combined with your degrees and your experience and your knowledge, knowing how to search the medical journals, I want to make sure our audience knows it's also some of what makes you ideal to serve them in the nutrition space. That degree in biology and biochemistry, lean into that a little bit.
Well, yeah, see, that's just it. I do not regret 1 hour of any of my previous education or experience, because I was actually in the pre-med, and then financial things I had to switch out, and I just ended up with basically pre-med courses without actually that stuff. But you can't take that basic anatomy, physiology, biochemistry once it's in here. And then I go into nursing, and there is a whole semester and 12 credits of pharmacology. And realize that a nurse in a hospital is responsible for handing that medication out. And it's a nurse's responsibility to question the physician if she thinks that that medicine is either inappropriate in what it is or how much or everything. So I had that in my head too. And then I come with my diagnosis, and I'm faced with medical literature saying one thing, and hearing, trusted physicians and looking at, protocols from well-established universities saying things that were contradictory. And it's like, okay, I got to get back to basic biology and biochemistry. If whatever you're doing doesn't fit with that innate biology, biochemistry, physiology, anatomy, it can't be correct. And that's how I have pursued things. So that when I read a book or a journal or a publication or somebody saying something somewhere, if it doesn't jive with basic things, it's in the trash.
That's what I love about you, Margaret. There's some no nonsense approach to you. So when you work with Margaret, because, I believe, and I know you believe, people are doing the best they can with the information they have.
Exactly.
But when you work with someone like Margaret to improve your health, you're going to get far more information that may challenge what you thought or what the status quo was or is.
Right. Now, and, it depends on what you're reading. And especially recently, with all this stuff about COVID and stuff, I read what the person who's written the article says. And they always are very careful about, annotating and giving their references. I go to the references. And sometimes what the reference says seems to have gotten jumbled when it comes out in what they published. So it's like, oh, time out. And then you also look at those references and see who funded it. Because usually the question that's answered is not an open-ended question. It is to prove something that they want to have proved. So they trash the rest.
Right. You and I, we don't want to make our audience run out of the room screaming, but we understand a little something about independent, randomized, double-blind, placebo-controlled. So, and
the requirements that the FDA has for drug approval, and where it goes into, supplements. The FDA was instituted primarily as a safety measure to get drugs on the market, to prove that the drug does what it says. Well, when you submit an application for drug approval to the FDA, one of the first requirements of the FDA in that process is you have to prove what the LD50 is of that product. LD50 is the lethal dose of that product that 50% of the lab rats die. Okay, so we already know that that drug is going to kill or is capable of killing at some dose. So they have to titrate to get you to something that won't kill you or, go toward their thing. Which is why when somebody says to me, well, the FDA doesn't approve this supplement or that supplement, and I'm thinking, well, good, because you cannot find a dose of ginger or garlic or an antioxidant that will kill you. You can't. And especially where antioxidants are concerned, which brings me back to my original, thing, because we've gotten into a lot more information, and it turns out antioxidants are really good, but they're only half the picture, because what works together is reduction and oxidation, and it's like a dog chasing its tail. They both need to be working together, and you have to have both of them up. And these days, when people talk about antioxidants, they don't realize that some of the things they're naming as antioxidants are really reductants. So the whole science of getting back to my original, nutrition classes in the doctor's office, instead of, we just didn't have the vocabulary of redox back then. But which is why when, we talk about basic health, if I go back to that glutathione model, just as a for instance, glutathione is something that our body makes. We peak in our early 20s, and after that,
we need it. The body needs it.
Right, you can't function without it. I mean, even Watson Crick, the people who define diabetes, have stated, and you can check, I don't know how many studies, in PubMed and all the rest of it. They have actually defined type 2 diabetes as a redox disease. It's a deficiency of how the body uses the oxidants and antioxidants to bring about health in the body. So, these days, we're not reaching our peak at 25. We're reaching our peak at 55 or 70 or whatever. And I need the tools that the 25-year-old body has to make my life continue the way I want it to. So it's just getting down to basics.
Well, and here, so I know about redox signaling molecules thanks to you, Margaret. Okay, so anyone who wants more information about that, you need to reach out to Margaret. It's significant. But Margaret, I know Margaret has other options in her toolbox, and you've already heard how she decided not to follow the traditional medicine route for her own diagnosis of breast cancer, and she's 70 and thriving. So Margaret, let's, you want to dig into a little bit about some of the options in your toolbox?
Sure. I have a simple 1.5-page intake form when I deal with a new client. And the most frequently asked question is, why do you want to know all this stuff? Because it's relevant.
Well, and I want to make sure people know that you are approaching it holistically.
Yeah,
you're not treating systems separately.
No, I have an intake that's for you, and I'm asking all these questions because it's specific to you. I frankly don't care if I'm talking to this lady what her husband's, feelings are about it. I want to know how she feels about it. And I need to know how that's affecting her life. And initially, she might not understand that what time she goes to bed and how she feels when she wakes up in the morning has anything to do with her food. But guess what? It does. And if you just think, in a simple analogy, food is the gas that you put in your car.
I know. And I like how you say people will spend more money and time picking the gas for their car than they do about putting that food, the gas, in their body.
Right. And they will take that car to the best mechanic and they'll do all the fix up and, I got to get the right oil to put in. and you spend less time making a decision about what you're fueling your body with than you do about your car. And yet, I don't care if the car works if I don't work. It doesn't make sense. So yeah, I ask a lot of questions. And part of the thing that basically my consultation, I feel like I'm the teacher, or as some
No, you
person,
absolutely are. You
well,
are a true educator.
yeah,
Absolutely.
somebody explained to me that, she says, you're like that person holding that lamp post to show the way. And that's really how I feel. I am not here to make my client do anything. I want them to understand what I see are the roadblocks in them getting to the healthy state that they want to be in. Sometimes, most of the time, it's food. There are some genetics that are involved, and that's what makes us all unique. Just a simple thing. Everybody will read, oh, turmeric is really good. Everybody should be using some curcumin, take more turmeric. Well, there's a couple of detox pathways in the body that can't handle curcumin. Well, why do I want to recommend that if you have that little issue? And I also have to thank the nursing, because I have looked at lab reports for 20 years. And
superior, I might add, the way you look at lab reports.
And
how you have informed people to ask questions of their medical doctors. And this is not to put medical doctors down.
No.
But when you have the biology and biochemistry that Margaret does, it's significant, and it has helped change lives. Margaret simply sets her clients up to maximize their chance at optimal health.
Right.
So go ahead, lean into that lab report. Go ahead, Margaret.
Well, yeah, lab reports are fascinating things because, we'll draw your blood because it'll see what's in your blood. I have learned over the course of years that just because it's in your blood doesn't mean it gets into your cells. There's a little gap in there. And just as a very simple, basic example, every time somebody is put on chemotherapy, pick any chemotherapy drug, the physicians know that it depletes magnesium. So they'll always order a magnesium level, and there's a reference range, and if you're in the range, you're fine. So I see this person on chemotherapy who's trying to maximize what they've got, and I look at their magnesium level, and yes, it's in range, and I ask them, so how are your bowels moving? Are you constipated? By the way, do you have leg cramps, especially at night? Well, yeah. I said, okay, you need more magnesium. Well, they said it's fine. Then I tell them, okay, the next time they draw blood, please ask him to draw a magnesium RBC, not just a straight magnesium. Quest and LabCorp still do both a magnesium and a magnesium RBC. The straight magnesium level tells you what's in your blood. A magnesium RBC, red blood cell, tells you what actually got into the cell. Every one of those people with the leg cramps and the constipation with chemotherapy have low magnesium RBCs. They need more magnesium. So why are the doctors bothering to order just a straight magnesium level when they should know that they need to order? So part of my job is to look at what the issues are, to see what labs have been ordered, to make suggestions, and to teach my client how to calmly, gently, and appropriately request labs that may be better for them to get to where their cells are actually able to accept and work with what they're doing. And things just work a lot better that way.
I feel like that's just, I know we can't highlight all of the ways you serve your clients. By the way, since 1999, and do you want to lean into a little bit about your grandma's inspiration?
My grandmother. Oh, yeah. Well, in other cultures and in other times, she would have been called a witch.
No, right? I know. And I feel like if anything's come out good out of this pandemic is people are looking for non-traditional ways outside of traditional medicine to improve their health.
And this whole wise woman, herb woman, witch, whatever you want to call them, these are just remedies that have been used for generations, for centuries. Who needs a study if when I give you ginger or peppermint and your stomach feels better? I can't go to the FDA and say, please prove that, because there's no lethal dose, so they won't even look at it. So my grandmother used to help me out with little health challenges along the way. And there were several. And she'd always say, well, here, have some of this tea, or, go and gather that and bring it for me. And her thing was, well, dear, an ounce of prevention is worth a pound of cure. So that later on, when I decided to get on this more healthy pathway and to try and show other people that there are other toolboxes to play in other than the medical little box, that's where your ounce of prevention yields your pound of cure. And that just looking, all of these things, they can't hurt you. And the benefits could be massive, substantial. So I went with that for the name of my company. And it's appropriate, and it's a good memory of my grandmother.
I love it.
And I appreciate her for that. And they used to tease me. I'm mostly gray now, but from my 20s, I used to have just a white lock here, which of course proved I was a witch. That's that's okay. It works fine.
No, there's nothing witchy here, I promise. You can't have all those degrees and be called witchy today. That I know for sure.
And the other interesting thing, Pam, is whenever a client asks me something that maybe I hadn't thought of, but oftentimes I'm challenged. Well, how do you know that? Or show me that. I can always find some reference in a peer-reviewed journal that would be acceptable to them and to their physician that proves what I'm saying.
And I know that to be true. And I know medical doctors don't specialize in that. What do they take? One cell biology course, right? Well, I think only about 5 institutions in our country require not even one full nutrition course. Isn't it only like 6 hours?
There are only 4 medical schools that require a course in nutrition. A course in nutrition.
And those are, food is chemical reactions in the body.
Why don't we start there?
I want to lead us into this food and food legislation, because I know we're almost out of time, but again, I just want to make sure the audience knows that Margaret's journey, education, background, and experience, and how she helps her clients is significant. And she can, provide consults to anyone around the world. So, Margaret, you want to share a little bit about that food and food legislation, or should we schedule another hashtag on point with Dr. Pam? Because that could be 20 minutes.
Absolutely, but it's an education, and actually on my Facebook, the 1 Ounce Facebook page, back last year, I did a whole section on food labels. A lot of information is on there, but if you don't know how to read it, you aren't learning anything.
Mm-hmm. And Margaret, one thing you taught me, I want to make sure everyone knows, one thing you taught me is if I know how to read it and I can say it and pronounce it, it's probably going to be a better choice.
Yeah, absolutely. You don't need a PhD to understand a label. And if you see words like that you have to ask about, just set it aside, put it back. And so, yeah, there are clue words on labels that I don't even need to read the whole label sometimes. If I see that one word, that's enough to say, no, thank you.
No, right.
And water is my other pet peeve, if you will.
Yeah, talk about that. You've leaned into that. You want to share your story about that? It turns out you and I both have some local water story issues.
Yeah.
This is a real concern. So go ahead, Margaret.
Well, the immediate concern here in Florida is the gyp stacks, and how basically one company is mining phosphate in the state of Florida to supply 80% of the world's phosphorus supply, which they use to fertilize, which you generally don't need. But anyway, so they're using the state of Florida to mine where only 20% of everything they mine is actually used in the United States. Florida is left with these gyp stacks that have heavy metals, radiation levels that are measurable, plus the other toxins and all of that left, which they collect into pools, which are supposed to drain down. Well, that's a new thing. And 2.5 miles up the road from where I live, there's an old gyp stack that leaks. They had to evacuate people from their homes so that they wouldn't die when we had a leak in that gyp stack, which, by the way, they've known about that leak for 25 years, and the funding just gets being shoved along. So
people tend to think this isn't a United States of America issue. It very much is. I'm in Maryland, and in this legislative session, Maryland is targeting Maryland's drinking water at risk. And so it's happening in Florida.
Well, and not only that, the entire world water supply is contaminated by arsenic. Now, okay, a little arsenic might be good for you.
Right.
So
it exists naturally in the soil, but not what we've done.
No, it's a different type. Now, that arsenic pollution has gotten so severe that the major baby food manufacturer, see the little picture of the baby on the bottle, has removed rice from all of its baby food because a 6-month-old eating a diet, including those rice products, would have arsenic poisoning. That's the level we have reached. That is, to say that's not sustainable, that's just ridiculous. It's not even believable that we could have allowed this to get this far. And yet, the arsenic levels in just about every state have been raised over the last 5 years. And when we challenge that, why are you raising the allowable amount of arsenic in our water? It's like, well, those are old studies. Okay, did you look at the people who are like children who are not thriving because of this? And, even go back and look at other cities up north that had lead in their pipes because of old infrastructure. This is our water that we drink. Lead affects IQ from cradle to grave.
And they've known that. What did they remove it from gasoline in the 70s?
Yeah, exactly. But the lead pipes, that's no problem. It's just transporting water. Well, it's transporting lead too. So yeah, I don't see that being passionate about our food supply and our water supply is really any different from being scrupulous in the selection of what food I choose to eat.
Right, because the water is going to hopefully nourish the crops.
Right, and remember, there is no such thing as organic water.
They put stuff in to make it so that we can drink it.
There is no such thing as organic water. So whatever else you may see on your label, if it took water to make it, grow it, there's your contaminant right there. So yeah, we need to rethink how we make our choices, because this is a lifestyle which contributes to health. And I prefer that my little toolbox not follow directly on the medical model.
Yeah, and let's try, since we have chemicals in our water we don't want, let's attempt to avoid chemicals wherever possible.
Right. And then
what I think of, Margaret? I know you and I could talk forever. You know what I think of? This is what I think of. They ask us to swallow a pill that is chemistry, but they tell us not to put it in the water or in the trash, but they ask me to swallow it in my body.
Yeah.
Now, again, this isn't anti-traditional medicine. No. But what Margaret helps you do is to understand that the toolbox is full of a whole bunch of other options that could help improve your health that don't have to involve chemistry, meaning swallowing some pill, which she describes so eloquently about the LD50. There are plenty of tools in Margaret's toolbox.
So yeah, and I like digging, which is why at my age I am not retired, because I love what I do, and the greatest reward for me is to see one of my clients thrive.
Yes. And Margaret, I don't know if you know this, but the research shows that the retirees are the most productive.
Thank you.
Right. I mean, and what better way than to serve people as they're aging, or she'll help young people too. Margaret helps all people, babies even.
Well, actually before they're born.
Oh, yes, yes.
I have in my practice now, she just had her 20th birthday 2 days ago, and her mom came to me having had 2 miscarriages and had trouble getting pregnant.
There you go, Margaret. We got to end on that. We've gone full circle.
It's a great life. It is. I enjoy every minute of it, and the sharing is just a bonus.
Right. And I want people to reach out to Margaret. If Margaret will, we're going to have Margaret back.
Well, sure. Look, the other thing, Pat, just one last thing. I say on my website, please contact me for a free evaluation. I will talk to my clients for 10 minutes without charge. It's important to me that we have some connection, that we, have some common ground, because if they can't find something that I'm saying is going to have value to them, there's no point.
Right.
So that phone number, it's my cell phone. Okay. Text me. We'll arrange a time. We'll spend a few minutes talking to see if we're a match. I'm happy to do that. I'm much happier doing that than somebody saying, I have to see you tomorrow. What? Right. Maybe I can, but that's not the point. The point is that we have a connection, that we can work together. And call me, email me, text me. We'll set up a time and we'll figure out how to get together and work. And we do phones, but I do Skype. Oh, well, just this morning.
Zoom. She does Zoom.
And this morning, New Zealand via WhatsApp.
Very good. Yes. That's all. So, Margaret, you're mastering that technology.
I'm trying. Sometimes I think it has the better of me, but we keep trying.
Right.
Thanks, Pam.
And listen, here's what I have to say to people. Being open and skeptical is the best gift that anyone gives themselves.
Yeah.
But when you meet with Margaret, her background, her experience in the hospital setting and nursing, and then her degree in natural health, all of that, and her biology and minor in biochemistry, it's a significant consult that you can have with Margaret to improve your health. So with that, I want to thank Margaret, and make sure everybody to go to Margaret's Facebook page too. And then for one last time, if you want to reach out to Margaret, 410-923-7443. And I'll see you soon, Margaret. Have a great
Thanks,
day.
Pam.